Okay, good morning. This is a presentation on a title called entitled Coping Strategies and Perceived Barriers of Women Hospitality Workplace Employees in Bahar Dar City, Ethiopia. This is a grounded theory approach, and this is part of an exploratory sequential mixed method study. And the parts of this study, two of the parts were published and presented in other conferences organized by the Millennium Medical College. And this is the presentation outline. We will talk about something about coping techniques in sexual harassment, then the methods, then results, and discussion and conclusion. So, sexual harassment is highly prevalent and it's common, and it's not actually studied in developing countries, including Ethiopia. And some of the issues are really dangerous, and they're dangerous especially for the women who are working in the hospitality workplace, as well as the organizations which employed them. And they are also a little bit dangerous for concerning for the government and for those organizations who are working in reproductive health related issues, especially regarding HIV/AIDS and other issues. And given the ubiquity or the pervasiveness and the common nature of this issue, multi-directional cause and multiple and all-round effects of sexual harassment, the ways the victims cope were different. And the difference in coping starts with the difference in the definition. And the definition is different according to the perceivers ideology, the workplace setting, and other issues. And coping as attempts to neutralize stress as an action that protects people from being psychologically or emotionally harmed. And it's a critical component of adaptation and survival that describes how humans recognize, assess, cope with, and learn from stressful situations. And coping strategies are psychological patterns that people adopt to manage their thoughts, feelings, and behaviors as they go through different stages in illness and therapy. And especially in this case, coping is important because people or women who are working in hospitality workplaces are expected to just cope the issues that they face regarding sexual harassment in their workplace. Consequently, coping strategies are numerous and varied as the stressors that precede them. It depends on the stressors. And the following are just a few examples. For example, accepting the situation or one's role in it is one sort of coping, active coping aimed at removing the stressors or oneself from the stressor, and anticipatory coping, avoiding or escaping, denying and disengaging, as well as distancing the issues that were studied before. And recently, as coping models strategies have become more elaborate, coping research is continuously moving toward the view of coping as a multifaceted process. So the choice of specific coping strategies used in response to sexual harassment varied significantly depending on the occupational status, gender, workplace climate or workplace culture, harassment severity, and the other issues. These strategies could be determined by the personal or occupational status and the environmental and the cognitive issues. There are also debates about whether coping is a single act or a process. That means if there is a circular process or a single act. Similarly, studies consider reporting only as a last resort. Applying preferred coping strategies in various situations makes the issue a persistent agenda in hospitality workplaces. Thus, this study aimed at understanding coping strategies, barriers, and facilitators as a basis for informing the development of data-driven and context-specific coping strategic framework dimensions. This could provide potential workplace sexual harassment prevention pathways among women who have been working in hospitality workplace of the urban city administration, specifically Bahir Dar city. So the study was conducted in Bahir Dar city, which is 1,820 meters above sea level and 578 kilometers from Addis Ababa, and has 6 sub-cities. The study was conducted from January 1 to August 30, 2019. And the study participants were women employees in hospitality workplaces, including bars, cafeterias, restaurants, and other hospitality workplaces. And they were expected to stay there, had some sort of work experience for 6 months. And they were contacted, the first person was contacted, or the first woman was contacted purposefully, and then the next were contacted based on the first client suggestion. It's snowball sampling, that means. So NGOs, community workers living in the city help us reach them, especially the Mahabara Hiyot, and key informants were recruited purposefully, and the enrollment of the study participants was continued until the study was thematically saturated. Was after the data was thematically saturated, we just expected to be theoretically saturated, and we continued until it was theoretically saturated. So the sample size and sampling technique, as I mentioned earlier, it was actually theoretical sampling, and after we identified the first client, the first participant purposefully, and did the analysis for the first interview. We just tried to go step by step, and I will describe it later on. So 10 IDIs, 6 FGDs, and in this FGDs and IDIs, 35 female employees participated in the FGDs, and FGDs each had 5 participants, 1 FGD had 7, and 3 FGDs each had 6 women. And sampling progression was stopped based on theoretical saturation, as I mentioned earlier. Based on the criterion-based purposeful sampling, 13 key informant interviews were selected, and the selection criteria was serving more than 6 months in the hospitality workplace with more than 6 female employees. The key informants were managers, cashiers, and co-workers. So the analysis process was followed like this type of procedure. So at the beginning, as I mentioned earlier, we tried to just purposefully sample the first client, then generate coding, or after collecting the data, we generate some sort of coding based on the interviews and focus group discussions. Then after the initial coding, we went through the intermediate coding, the advanced coding, and at the end, we tried to develop grounded theory. In the meantime, we tried to do memoing and constant comparative analysis, and we expected the data to be theoretically saturated. Management and assurance, we tried to do some issues regarding the credibility, dependability, transferability, and confirmability. Except the member checking, we did all the things I can say. So the interviews and the FGDs were edited and modified by qualitative research experts. The facilitators of the FGDs and IDIs and key informants, the supervisors, were invited to check the correct representation of the study's findings and ideas after the write-up, and the data collected from female hospitality employees, supervisors, cashiers, and customers were validated and invited the people participating in the interview and focus group discussion, sent the transcriptions by email and received comments from them. And respondents' bias and the risk of reactivity were ensured by holding back researchers' predetermined ideas about the issue under study. and using the female data collectors. So the participant characteristics were actually, as I mentioned earlier, 58 respondents were participated in this study, and their age was from 18 to 30 years. And managers, cashiers, and customers worked as, especially customers worked as merchants, tour guides, and drivers were the study participants. This table showed the socio-demographic characteristics of women who had been participated in the in-depth interviews, and this is the key informants socio-demographic characteristics. So let's go to the main finding. So after all this process, we try to just produce a framework which is called the sexual harassment coping mechanism framework. And this framework was a standalone framework, but it had some sort of facilitators and barriers besides. And while we asked the women, they just mentioned these things separately, but after the study, after the in-depth analysis of the issue, we tried to just thematize in this way. So this is actually, as I mentioned, this is comparative analysis. So the first thing that the issue that they raised was normalization. And it was the normalization was ideas and behavior that all outside social norms are regarded as normal. They just considered it as normal. Sexual harassment, they considered it as normal. And the second, after they just tried normalization, I will describe the components that I mentioned under normalization. They just try to normalize. If they fail to normalize, they try to just engage, or they want to just solve the problem by themselves. So engagement was about oriented towards addressing sexual harassment. And the third step was help seeking. If they fail to just engage and solve the problem by themselves, they try to just seek help. This help seeking includes informal social support seeking, informal organizational support seeking, and formal organizational support seeking. The organization to mean that the hospitality workplaces and the legal authorities. And the fourth and the last is leaving the situation of the perpetrator. This is detachment. So the framework is interconnected and had 4 components which are interlinked. So the normalize, then engage, then help seeking, and then detachment. So under the normalization, they try to mention about, in order to normalize sexual harassment, they try to accept, ignore the perpetrator, accept the issue that it's common, and they try to avoid by just denying these things are happening there, and denial, tolerance, and grief. Some of them grief, they will cry in anger somewhere else, just far from the perpetrator. And the next that I told you is engagement. Under this, they try to confront, refuse, discriminate, threaten, or negotiate the perpetrator. The perpetrator, that means the person who is just acting as a harasser. So the third is help seeking. Under this, they try to discuss with their friends. They try to ask help from their friends, their boss, and whatever they just get around them, and consulting psychologists, consulting healthcare professionals, and praying, accusing, and something. These are the help seeking. While the accused, they just seek help from the legal authorities like police or something. The last, but not the least, and the most dangerous one, which makes them to just job hop or change their job or drop up from their job or work from their, withdraw from their work or withdraw from their job, and keeping their distance from the facilities that they were engaged are the most important component is that they were mentioned by the participants. So this was the framework, and these are the issues that they do while they face sexual harassment at hospitality workplaces. But these all things face some sort of barriers and facilitators. For examples, for normalization, the barriers were that while they just try to normalize the issue, they were considered as they are interested because there are transactional sex practitioners there in the hospitality workplaces. These transactional sex practitioners are interested in doing some sort of business. They do have some sort of business outside their place. They might be commercial sex workers, but they just came to the hospitality workplace and they stayed there and they show some sort of interest for the perpetrator. And all the women who are working in the hospitality workplaces are considered to be interested in sexual issues due to the presence of those transactional sex practitioners and due to their effort to normalize the issue, to just solve the issue that it is common. And the facilitators are the promotion. If they normalize, the organization will promote them, will write recommendations for higher hospitality workplace like 5-star or some hotels, and self-confidence and moral. Some of them have some sort of self-confidence that they believe in them in themselves, and they do have some sort of moral, and they want to just normalize that issue. They believe in themselves. And the other is a religious belief. They believe in God, so they believe that God will protect them in that situation, and supportive networks like some people around them, they believe in the support of their community, and positive thinking and optimism are the facilitators. Whereas engagement, the barriers for engagement are lack of knowledge. They want to engage, they want to serve by themselves, they want to go to the police, they want to go to the justice or women and social affairs office, but they don't know where it is and they don't know how to do that. And lack of facilities, even if they want to just go to these facilities, they just lack, they don't have the facilities there in their surrounding. And this implies that there is inaccessible surrounding for the help seeking, engagement. And the consequences for engaging are distribution of bad rumors. The perpetrators and the organizational leaders, they just distribute bad rumors about the woman who just tried to engage in solving the issue. And they talk that the woman is interested in something and fired from the job. If she confronts with the client, the manager will fire her or kick or slap or rape. And the other is demotion, insult, and false accusations are the issues that were raised in engagement as a consequence. In help seeking, they try to mention only the barriers, perception of legal bodies, deep-rooted beliefs and norms of the organization, insufficient managerial skill, and lack of financial resources and lack of societal acceptance or support are the barriers for help seeking. And the barriers for detachment were, if they detach, if they just keep their distance, if they job hop, or if they go to the roadside to just sell coffee and live their life, the perpetrator will hunt them, will follow them. And lack of employment opportunity. After that, most of the women who are engaged in hospitality workplace who are enrolled there are had some sort of education or skill. This is the problem. So if they leave that opportunity, they will lack some sort of employment opportunity in other places. And some of them are, if they just had some sort of exposure for sexual harassment, and if they had some sort of friend who had been practicing transactional sex, they will engage in commercial sex work. They will have their house and they will do commercial sex work. And lack of financial resources are the barriers for detachment. So all these things were practiced, but these things were also the consequences, the facilitators, and the barriers for the practice. So these issues were not the only issues that they raised. The coping strategies were insufficient to cope with sexual harassment, as I told you. All the things cannot be addressed with this framework. So as I told you, the challenges were lack of knowledge, lack of complaint procedure, social discrimination, lack of strategies and policies at the government and at the organizational level, and insufficient organizational managerial skill, or the presence of transactional sex practitioners, gender bias, victim blaming, lots of challenges. So this leads to challenges in sexual harassment coping. So in addition to the issues that we mentioned, the framework that we mentioned, they suggest these activities. They suggest the stakeholders, some of the people who are leading some organizations like legal authorities, the Ethiopian labor and social affairs authorities or ministries, and the Ethiopian Ministry of Health and something to do just these things, these issues. First, they need them to adjust the work shift for female employees. The organizations, the hospitality workplaces should adjust work shift for female employees. That means the workers were expected to stay there until 4 midnight. So this is the time where the perpetrators who are alcohol addicted are present in these places and they are exposed. So they want to be assigned at daytime and to just shift the work for male hospitality workplace employees at this time. So establishing formal complaint process and training system was the recommended issue for organizations, and formation of disciplinary procedures were the issues that were expected from the hospitality workplaces. And the other and the most important issue is improvement of employees' wearing style. The wearing style is the most dangerous one and the most provoking issue at hospitality workplaces, as you know. So they raised the issue to be improved. Actually, they mentioned lots of issues on this issue. You can get it on BMC Psychology. It's published, and you can get lots of issues about this issue. So establishing of regular psychosocial support. The psychosocial support is actually the most important issue that mostly cited in scholarly papers, and regular psychosocial support establishment was the suggestion that surprised me while I asked them. So community awareness, dedication of promotion calendar, multi-sectoral collaboration, regular and active monitoring, improvement of employee management, respect of employee rights, posting awareness creation posters at the hospitality workplaces, and preparation of sexual harassment prevention standards and policies at the organization level, plus implementation strategies at the ministerial level, and women empowerment were the suggested issues. So they suggest for themselves also. So one of the issues that they suggest for the women hospitality employees were they should struggle for their rights. They should establish professional associations for their who struggle for their right, and consult legal bodies and healthcare professionals for the issue. For example, one of the respondent mentioned that I think the solution is protecting ourselves. Even the police will not respond to any sexual harassment activities which happen in front of them. Additionally, the police are the perpetrators on the road. The other solution is praying. She said this. She was 26 years old in the focus group discussion and 5 years experience in the restaurant. So as a discussion, so the determinants of coping with workplace sexual harassment and the barriers are all local, with specific characters that must be realized or appropriate standards to reduce the risk of workplace sexual harassment. That means the hospitality workplace. However, most of the sexual harassment prevention program interventions are guided by the broader legal, regional, or national level framework. Actually, there is no national level framework, which lacks essential elements of sensitivity and compatibility with the target community's local needs, priorities, and aspirations. So the other issue is a top-down approach often fails to recognize the vital role of communities. It ignores the potential of local knowledge, resources, and capacities. and saliently increase women's employees' vulnerability to multidimensional impacts of sexual harassment. So the determinants, characteristics of vulnerability factors, and barriers vary based on occupation, gender, and cognition of the victims. Sexual harassment reduction interventions that derive from contextually irrelevant strategies are fundamentally ineffective. So we argue that the intervention targeted at reducing workplace sexual harassment, specifically hospitality workplace, and its impact shall be supported by scheming and applying advanced strategies identified by scientific, research-oriented, and evidence-based coping strategies. So we inductively constructed coping strategy and barriers that can address the gaps in science of sexual harassment coping strategies. And these are guided by limited understanding of the nature of the perpetrator, the cause, sexual coping challenges, and the socioeconomic characteristics of victims in specific settings. Thus, these studies findings and the new framework are helpful to design and apply circumstantial and locally appropriate coping strategies to increase women's employees' capacity to withstand and consequence of sexual harassment. So as a conclusion, the analysis indicated that the coping strategies are not live in a single category as it was mentioned in the introduction. Instead, the entire framework interacting with one another constitute coping. So the framework is context specific and it is advantageous to guide sexual harassment response, development to enable women employees to cope up, adjust and recover from the impacts. So building coping strategies against sexual harassment requires interventions that strengthen the 4 components in concert and at multiple levels, meaning individual, hospitality workplace, and legal bodies. All coping strategies dimensions would cause a strong influence on both women employees and hospitality workplaces. However, strategic dimensions such as normalization and engagement would substantially influence women employees. So there should be a prompt concern for these types of coping strategies. This framework could also help implement interventions that could eliminate the link between sexual harassment and reproductive health impacts, such as the women's employees' involvement in transactional sex practice, commercial sex work, and prevent women from acquiring menstrual abnormalities and sexually transmitted infections. Therefore, any intervention needs to debate the barriers, facilitators, and outcomes related to response elements. While the framework offers suitable direction to understand, lead up, and design context-specific responses planning, it is likewise essential to test the applicability, conceptual, and statistical relationship among the coping strategic dimensions to appropriate sample size and method. These are the references, and thank you very much.